you've been through a lot in your cancer journey.
Mm.
When you consider the two operations, I didn't actually ask you whether you'd had follow-up treatment, i.e., chemotherapy or radiotherapy or other maintenance treatments.
I've had chemotherapy. I had that before I had my mastectomy and my reconstruction. Yeah.
How difficult was that to tolerate?
The chemotherapy. I was very frightened before I went in. To have it, had a talk from a lovely young nurse on the ward before my first session, who was very sparky. She was a bit of a goth in her spare time. She was lovely. Told me what would happen, told me that my urine would turn red when I'd had this treatment. It's called the FEC treatment. So I've often referred to it as the fecking treatment, which indeed it is. I was very frightened. I think the actually the treatment I had, you have it injected in your hand, in the veins, and the nurse sits with you for the hour that it goes in, and you have to have blood taken to see if your white blood count is okay 2 days before, so you have to go to your GP and have some blood taken. And at first I was one of these people who, I have apparently difficult veins, so getting the blood out was often a challenge. So that was difficult. First time I had the chemo, okay, it just wiped me out basically. I was okay, went home and just went to bed for a week. Could not get up. In fact, it was my mother-in-law's funeral on the Wednesday, after the first treatment. I couldn't get out of bed to go to the funeral. There was no way I could get out of my own dressing gown. So all you can do is to get to your own bathroom and back. So it wiped me out for a whole week, and it did that every time for 6 times. The second time I had it was particularly difficult. I'd collapsed in the GP's surgery due to not being able to, I don't know why. And then when I went in on the Friday, I used to have it on a Friday to have the chemo in, they couldn't find a relevant vein, and it ended up with the curtains drawn round and a big session, and the sister had to come, and eventually I thought they were going to have to go into my legs for the vein, but eventually went right up my arm and got that in. So that was horrendous. The chemotherapy suite is ridiculously small, the facility I was in Leicester, and unfortunately you are very much cheek by jowl against it. You have more room in the hairdressers, quite frankly, because there's a chair here, there's a chair here, there's a chair, and you see people who are very ill and have tumours that you really wouldn't want to see, and that's a frightening prospect for anybody who has been. I was previously well. I'd only been in hospital to have a baby. Nothing had ailed me, and I was very shocked, and I was frightened because people were walking around with tumours, and you can't stare, but by golly you want to, and you're mixed in, and then the pressure was so much on the unit, and they were treating so many patients that at one point when we had overspill, those who could get up and walk with their drip had to go in the waiting room, and the others had to come in. And quite frankly, it was just like a conveyor belt, and that was hard. But the staff were lovely, very nice, very understanding people, and they're dealing with a vast amount of people, and that's the shocking part. You think nobody's got cancer, or you read these statistics, and then you go in and you can't put a pin down, and it's just so. And I was okay. I was not sick. I didn't vomit once in any of the treatments. I was just tired. I was tired, and I lost all my hair. But the great benefit, ladies, is you lose all your hair everywhere. Absolute bonus. A marvellous bonus. But you're just too disinterested to bother. But it's great because all body hair falls off.
Do you think that anything could have been done differently during your care?
I didn't really get along with my oncologist. He was rather arrogant, I felt. I was, at this time, they see you on the 2nd, 4th, and I think the last visit they don't see you every time. He was insensitive, I think. He said to me at one point, "Oh, you could go for this clinical trial," and he had the protocol on his wall. And I looked at it, I read it, I said, "No, yes, yes, no, it's a decision tree." I said, "Yes, yes, no." I said, my cancer is not that size, or I'm not in that age group." He said, "Oh, I thought you were." I said, "Well, no, I'm not." And I thought that was hugely wrong. Then I was in deliberation as to whether to have a mastectomy or radiotherapy, and I was seeking advice, and he said, "Well, I can't tell you, I'm not a surgeon." So that was unhelpful. And he put me, what happened? He put me into tailspin then. I had 48 hours then of complete worry, because I didn't know what to do. We didn't know where to go for, I'd had all the advice about the operations, but I was in a complete tailspin, and it was difficult. And that was worrying. What could have been done differently? I think the treatment was fine. I mean, as I went along, we realised, because my veins were not, perhaps as prominent as others, I needed to have my hands in some hot water, bowl of water. I needed my hands, I asked for the, you can have a spray that just numbs down the needle going in, and that sort of tip.
I think you had another incident involving the surgeon regarding consent.
Yes, this is really quite recent. It was my sort of final visit to the plastic surgeon, and I was actually seeing the surgeon himself as opposed to one of the team. So I went along, and I wasn't well at the time. I had a cold, and unfortunately, with my immune system being down, it had hit me rather heavily, and I couldn't walk far, so I was in a wheelchair. But great. And I went in and stripped off, and he had a look, and he said, "Oh, marvellous, marvellous, yes, what a marvellous job I've done," sort of thing. I said, "Yes, it's quite good." And the nurse didn't say anything. She just stood nodding and saying, "Yeah." And that was very quick. And I said, "Well, actually, yes, but, it's unmatched to the other side." And the photographs I'd seen previously, I'd been shown of previous patients' breasts, both breasts were matching and both looked perfect. And I thought, well, this isn't what I was expecting. So he then got my other breast, squashed it up and said, "Yes, well, we can do something about this when you want." And I said, "Well, not yet, because I've had rather a lot of treatment in the past 18 months, and I'd like to wait. Can I see you in 6 months?" He said, "Well, people don't usually." I said, "Well, I'd like to see you in 6 months so that we can see what's the next stage, and whether in fact the fat necrosis in my left breast, the breast that had the cancer, has gone down or dissolved or whatever, atrophied." So he said, "Oh, yes, yes, yes." And then he said, I told him I was wearing a prosthesis shell that I'd got from the fitting clinic. And he said, "Oh, I'd rather you didn't wear that." I said, "Well, I'm sure you would, but it for me, it psychologically makes me look and feel better." So then, as we were saying, "Yes, I'll see you in 6 months," it was very quick. He sort of said, "Now some photographs." And I didn't really think I could refuse. It didn't occur to me. I wasn't really I wasn't expecting that. And it's the same every time you go. There is another smack in the face. "Oh, and now cancer," smack. "Oh, now mastectomy," smack. "Oh, MRI," smack. "Oh, and have some photographs taken." And I thought, okay. So then I had to be wheeled up to the photographic department, medical illustrations, which was humiliating enough as it. Anyway, I felt very ill. Although it was just a cold virus, I felt really low. So I got into the room, and my husband came in with me, and the photographer said, "Do you know why you're doing this, having them done?" I said, "Well, I presume it's for the records." He said, "Yes, they're just digital. We don't put them in the records or print them out." And I said, "That's okay." But I stood up, stripped to the waist, and turning this way and that, and it wasn't a glamour shot. It was tears were rolling down my face. I didn't expect to feel like that. Terribly shocked and upset. And then afterwards, I mean, the guy was very professional. Afterwards, I got dressed and I just broke down. And that was one of the worst points of my journey. A low point. And I went home and I went to bed. And I just thought, has my life come to this? You know, what the hell am I doing?
It just reminds me that if somebody's upset during a procedure, that's when the procedure's optional, it should flag to those involved that something's wrong, that person's not comfortable.
Yeah.
Now, it could be that they're willing to still have those things on record, but
not
you should check with that person.
Yeah.
And also afterwards, if you're obviously upset at the time, there should be a system where you can easily access support on some level.
Wow.
Even if it's
A cup of tea.
something simple.
Yeah, I mean, there was nowhere to go. I broke down in the studio, and Derek and I went out, and the photographer didn't say a word. We went out in the corridor, and another man went, and the next patient went in, and it was a tiny corridor. There was nowhere to go. Derek just wheeled me out, and I was sobbing my heart out, and we just stopped then in the corridor, and he said, you know, come along, Livia, I'll take you home. And there was nowhere. I just needed a cup of tea or a hanky or somewhere to sit and come round, and for somebody to realise that this was total invasion of my body.
Well, the problem came actually before.
It did.
Where these surgeons suggested the photos, they should have said, look, this is a very personal thing, to have the photos at this stage.
It
Not
didn't.
everyone was comfortable with it, and obviously
No.
you have to get undressed. Do you feel you can go through with that now? And that simple line of questioning would have helped.
It would have helped enormously, because all he did was get a red form. I remember it being red, and say, and I signed it, and of course I gave consent, but I'm afraid, however in control you think you are, as a patient, you lose some of your rationale because you're too emotionally charged. And I was just getting dressed and getting over the fact that he just handled me like a piece of meat. And I thought, well, you know, photograph's so short. It didn't occur to me I'd have to get undressed. I mean, I know it should have done. It's a breast, goodness sake, and they can't, you know, it's not an X-ray. They can't see through my clothing. But you're right. A simple, Janet, you will have to get undressed here. You will have to stand and pose in 3 different poses, might add.
This is the difference, can I add, between consent and informed consent.
Yeah, thank you.
Consent is not just a tick of the box, but unfortunately the medical profession, for various reasons, sometimes
Quick
treats
option.
it like that.
It was a quick option. He just said to me, we need these for research. And I thought, yeah, sure, fine. You know, I'm not going to stand in the way of medical research, but no. And I felt humiliated. I felt betrayed. I felt a freak. My body image had been a big concern, and if you look at me in the nude, it's not a matching pair. Needless to say.
So I think for other patients watching this,
Yeah.
people need to
Be careful.
know that they can refuse things
Yes,
that are optional.
yes, and I should have known that. I could kick myself, but yeah, you know, in the heat of the moment, in a moment of, and I don't think. I mean, I wouldn't say this guy is particularly cruel or anything like that. He's just, he's done thousands of these operations. I know he has, and it's.
It's just a routine for him.
It's routine for him, but for me, it's my body.
It's personal for you.
It's personal, and that's been the whole crux of coming to terms with your body image. It's just, am I still Janet? Yes, I am. But I can't. It was a terrible experience. It was. I would say, it wasn't painful. You know, I have had some pain during this very many procedures. It wasn't a pain, you know, a needle in your breast or anything like that. It was just, it triggered me into a depressive state for the next couple of days.